This is the implementation of diabetes self-management education and support to decrease hemoglobin A1C. Diabetes is a chronic and progressive disease which affects the kidneys, vision, circulation, and contributes to development of heart disease and stroke. It is similar to heart disease, which is a silent killer. 1 in 5 people with diabetes do not know that they have diabetes, and elevated blood sugars are having negative effects on the individual. It is estimated that 338 million Americans have diabetes, and this includes type 1 and type 2. 90 to 95% of people with diabetes have type 2, which is acquired mostly because of modifiable risk factors such as diet, exercise, stress, and unhealthy coping mechanisms. 98 million Americans are at risk for developing diabetes are unaware. Diabetes is the 8th leading cause of death in the United States, and costs related to the disease are estimated to be $413 billion in medical costs, loss of work time, and wages. The medical cost to treat a person with diabetes is twice that of someone with the same diagnosis who does not have diabetes. It is estimated that there are currently 181,000 people with diabetes in Miami, Florida. Implementation of diabetes self-management education and support programs, which is endorsed by the American Diabetes Association as an intervention to empower people with diabetes to manage their own condition, decrease complications such as loss of vision, neuropathy, and renal failure, has shown to be effective. The proposed intervention in this project site is the DSMES program to decrease hemoglobin A1C in the community. The PICO question is, in adult patients with diabetes, does the implementation of the American Diabetes Association's 2022 National Standards for Diabetes Self-Management Education and Support Program, compared to current practice in a community hospital, impact hemoglobin A1C over a 12-week period? The DSMES program is an evidence-based, learner-centered, culturally sensitive program which meets and exceeds quality standards set forth by the Centers for Medicare and Medicaid Services. The program should be designed to be interactive and creative. Each participant will have a plan tailored to their specific learning needs based on the assessment and evaluation of the certified diabetes educator. Together, the certified diabetes educator and participant will determine the greatest opportunities to learn about how to manage their condition. DSMES is endorsed by the American Diabetes Association and the Association of Diabetes Care and Education Specialists. DSMES has shown to improve patient self-efficacy and empower people with diabetes to manage 99% of the condition. In transferring the care and management of the disease from the acute care system to the individual, the person with diabetes develops an increase in confidence, skill, and increase in knowledge to accept responsibility for managing their condition. DSMES has shown to improve clinical outcomes by decreasing length of stay, decreasing 30-day readmission rates, decreasing unnecessary emergency room visits, improve wound healing, and decrease the risks of complications and comorbidities. Participants of DSMES have decreased hemoglobin A1C by at least 0.6%. Nationally, DSMES decreased annual healthcare expenses in the U.S. by $3.9 billion in hospitalizations and $735 million in emergency room visits annually. The ADA does not specify how the content is to be delivered, but the guidelines include major components such as pathophysiology of diabetes and treatment, healthy coping strategies and eating habits which are culturally acceptable, exercise and the importance of being active, pharmacology and how to properly take medications, as well as monitor for side effects such as hypoglycemia along with management, self-monitoring, and self-care activities such as foot checks, vision exams, and self-monitoring of glucose, reducing risk of complications, problem solving and behavior changing strategies such as smoking cessation, Overeaters Anonymous, and other local programs that can provide additional support throughout the journey. Participants will attend a total of 10 hours over 2 months. The first 6 hours will be a virtual visit during the first month and a half, and the last 4 hours will be done in person in a speed dating fashion. Speed dating has been associated with a greater decrease in hemoglobin A1C than traditional education formats such as lecture with return demonstrations. Speed dating has shown to decrease the hemoglobin A1C by up to 1.2% as opposed to 0.6% with traditional methods. The initial appointment will be a one-to-one assessment with a certified diabetes educator, followed by individual sessions with a pharmacist, dietitian, case management or social worker, physical therapy, and a nurse. 4 hours of the program will be done in person, and participants will rotate through speed dating stations with each of the above disciplines. In order to set a good foundation for sustainability, the project lead will involve team members from various disciplines, including the certified diabetes educator, in the development stages of the program, so as to increase buy-in and engagement. Details of the program delivery will be developed by the team. Recruitment of participants will occur prior to discharge, and the project lead will also collaborate with endocrinology and hospitalists for referrals. Flyers can be disseminated throughout the organization as well as through community programs. Baseline hemoglobin A1C will be obtained from daily report in the acute care setting and will facilitate selection of possible participants. Those that choose to participate in the program will have a repeat hemoglobin A1C drawn in 3 months for comparison. Education team members such as the certified diabetes educator and disciplines including pharmacy, physical therapy, nutrition, and social worker or case management will come from the acute care setting. No additional full-time equivalents will be required to contain costs. The organization is known for excellence in community programs and has a good reputation. This is one of the greatest strengths of the project site. One of the weaknesses identified is that recruitment can be a challenge in transportation for the speed dating component may not be accessible to all. One opportunity is to leverage social media presence to assist with recruitment and explore options through other community programs within the organization. Networking can be a way to provide other eyes and ears in the community and bring others and participants to join. One identified threat is other competing programs in the community. The success of this program lies in the theoretical foundations of Albert Bandura's theory of self-efficacy. Individuals can be taught skills and knowledge which contribute to a desire to work toward a goal, given the understanding of the benefits. Participants choose to attend willingly and have an interest in self-management. The program is not a requirement, but done on a voluntary basis. The PDSA model of evidence-based practice will guide the program development as the need arises and opportunities to improve the program present. Small changes can be made as needed. We will start with a small sample size and implement small cycles of change as needed.